Dr. Blum, can you show us actually how to floss and when to floss?
My pleasure. Well, when to floss, the best time to, obviously if you get something stuck that's uncomfortable, you're going to wind up flossing it out. The best time to floss really is before you go to bed, because when you go to sleep, so do your salivary glands, and there's not a lot of action of saliva to help get things out. Now what I do is I take a pretty decent sized piece of floss and I wrap it on these fingers like this, so that in essence I have a small area that I'm working with, okay? And eventually then you can undo it and you can do all sorts of things. My technique is one in, one out. What I mean is that there's usually a finger in the mouth and there's usually a finger out of the mouth, and that will switch sides. So if I'm doing the lower left here, 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 and by the way, the amount of time I'm spending is all you need to do. I know that there's some people, 30 times on this side. You can do that, but when I'm done here, I'll explain why that's not really necessary. Okay? Then I would switch. Then this finger becomes the one in the mouth. Go around the rest of them. Upstairs, right in the middle. Here, here. Up. Simple. The first time people try it, if they haven't done it, they wrap it around their heads a couple of times, but it is something that's very, very learnable and very, very easy to do. Now, people think that when they brush or when they do this, they're removing all the bacteria in their mouths. That's not what you're doing. Bacteria is actually a very organized complex. I kind of equate it to like an anthill. And what you're doing when you're flossing is like stepping on the anthill. So the ants scatter, the bacteria scatter, they can't really do anything. So what do? They reform. They create another anthill. The next day, what are you doing? You're flossing. So you're just continually, you're just a home wrecker. You're breaking up that happy home that the bacteria has between your teeth. That's why you don't really need to spend tons of time in there, but you do need to get in there, and obviously if there's any physical stuff that is stuck there, that needs to be removed too.
All right, thank you.